Welcome back everyone for part 3 of improving breathing and shoulder health with at-home soft tissue work. So remember, you're going to need a lacrosse ball or a baseball when you're doing this exercise. So in part 1 we talked about finding a spot under this clavicle, not on the deltoid but right under this clavicle region, and find that tender spot. And we talked about breathing in it. And then part 2 we talked about doing scapular retractions in that tender spot. Now third, we're going to take it through a further range of motion, because as your arm goes overhead, your arm starts to turn out, and as your arm goes down, it turns back down. Same with breathing. As I breathe in and out, my ribs are turning up, and then my ribs are turning down. So there's a rotational component to this. So we have to take that into consideration when we're trying to improve breathing mechanics with the shoulder and some soft tissue work. So now we're going to find that tender spot, and the spots may change. So remember, you may not always have it on the same spot, which is fine. That's actually good as you're starting to change positions. And remember, if you have that port, you want to stay away from that port, closer to the sternum if you can versus towards the shoulder. So I've done part 1 and part 2. Part 3 now is I'm going to bring my arm to a 90 degree right here, and what we're going to happen is I'm going to do the scapular retraction first, just to where the elbow's in line with the mid portion, so I don't want you to tip. Okay, so it's just shoulder blade. Remember, the lacrosse ball is on that tender spot, and you may get some pec out of this, some chest muscle. That's totally fine. So I'm going to pull back, then I'm going to take my thumb and turn it out. It's not going to be a lot. Come back, go forward, retract, turn out, and go forward. And all these exercises, even the breathing, we're going to be doing for about 10 repetitions. So from an angle, so I'm going to pinch. Once my elbow's in line with my side, I'm going to turn out, which is not a lot. We call this external rotation. And then I let my shoulder go forward, pull back, and I rotate. And what's happening here, it's allowing the arm to move through the joint along with the shoulder blade. So when the ribs get tight from breathing mechanics are off, as we loosen the ribs up, we need to take the shoulder with it, so it allows it to kind of synchronize. So stay tuned for part 4 as we go through our last little exercise to help improve your respiration through some soft tissue work while utilizing the shoulder at the same time.